direct response to the school tragedy in Texas. And there's several takeaways. One of the biggest ones is Berks County schools have, over the last 12 years, had in place annual school safety plans. And through the years, we looked at those at the beginning of our meeting. They have been improved and enhanced. And what we saw today as an opportunity to further improve school safety across the county of Berks by bringing together stakeholders from all 18 school districts, from law enforcement, from education, a wide range of organizations and stakeholders. The program was co-hosted by our district attorney, John Adams, and his team, Dr. Jill Hackman, and the Berks County Intermediate Unit, and the Berks County Board of Commissioners. If we look at the big takeaways, I'd say number one was mental health. So many of the issues today revolved around mental health needs, budgetary needs. It was noted that the schools have made it clear to the state that they need help in budgetary needs around mental health and also around school security. It was noted to us through Representative Joswiak and Representative Gillen that there actually is legislation under consideration right now dealing with school safety and funding. We'll be giving input into that. There were a number of opportunities that we're not going to really talk about right now, but opportunities that were highlighted by the schools primarily that we can address. Two that I will touch on was a suggestion that when we look at healthcare, we need to engage to a greater level with the healthcare community and specifically the mental health arena. And then secondly, further engage with children and youth services. We didn't have representatives from those two entities here today, but that clearly came out. So very, very good program. I do want to note, and this is my last comment, we really appreciate, and John and I were involved in an email exchanges over weeks. We appreciate Dr. Hackman's leadership. I want to make it clear that without Dr. Hackman's leadership and her team at BCIU, this event would not have occurred today. This occurred because of all of the work and preparation that you were willing to do. And John, as our district attorney, and myself and the commissioners were thrilled to be able to participate and be part of this.
Thank you, Commissioner. And if I could just add one quick comment before we go into questions, it truly is a team effort. What we saw today, and my colleague here, Mr. Russell Del Rosario, who's in charge of safety and security for the IU, we feel fortunate for the collaboration, the coordination, the communication that we have from all of our stakeholders in Berks County. So what we said is, well, we've had a lot of work that we've done over the past 12 years in school safety. There's more to do. And we're committed to continuing to serve and collaborate and coordinate and communicate with all of you. So thank you.
Well, I just want to make one comment. I think that the general public needs to know that this has been a priority for all of us for many years. And under the leadership of Dr. Hackman, we've been holding regular symposiums and getting on the same wavelength so we know that we are addressing school safety throughout the whole county, and we're addressing it so that we're all prepared, and we will remain prepared.
And I think that's important. It's one of the reasons it was so easy to get all the stakeholders together today. The one other takeaway, there was unanimous agreement. We will be scheduling a follow-up meeting, and between now and that meeting, there will be a series of subcommittees looking at a number of the issues that were raised at the program today, and hopefully be in a position to address maybe not every single one of those, but the most significant ones, at least between now and when that meeting will be scheduled. And no, we don't have a date or a time. We'll be working on that though pretty quickly. Open up to any questions.
You mentioned mental health as being kind of a major topic. Is there any aspect in particular? I mean, is this identification? Is this access to services? Is it everything? Is it kind of general?
Access to services, it was highlighted that it is very difficult to get services for parents that may have children that need a psych evaluation. Staffing is an enormous issue. Even the issue of training and certification it's very limited. So it's a matter of budgets, but it's also a matter of people. Everywhere, our own mental health and developmental disabilities department, Michelle Rwana-Weber spoke, it is difficult for the various providers to have enough staff. But mental health is a major issue, and we're going to do what we are able to address it. And let me add, we're not coming out of this meeting with a number of items. We need the state to do this, the federal government to do that. In fact, there was very little of it. I highlighted the only part that came up was with Representative Mark Gillen and Representative Barry Joswiak, and we appreciate that. That was very helpful. But everything else we're talking about are things that are in the power of the county, the school districts, our various stakeholders and partners.
What's throughout the years of these types of meetings, what's the biggest thing that has changed over the years until now?
Well,
go ahead.
I don't know. I mean, we've been having discussions about this topic for years,
Mm-hmm.
and I think we've addressed all different aspects of school safety, from drug use to the actual shooting preparation, if you would have an actual shooter, all aspects of the school environment, and to make schools a safe place here in Berks County. And give all the credit to the BCIU, who has taken leadership of that issue here in our county.
Yeah, I would say one thing that we've seen in evolution is the social media connections. And that seems, from when we started 12 years ago to where we are today, that network and communication continues to expand. And that's an area that we continue to monitor. But all of the response, intervention, prevention, those things, it continues to be that we just need our training to be annually and ongoing because we have new staff members. But the big change I would say that we've seen across the education community is related to social media. I don't know, Mr. Del Rosario, anything else?
No, I would agree, and we've worked as schools with the response part of event planning, but we need to really look at prevention and mitigation, especially discussion of mental health as well.
Yeah, I would also add that the threat has just, you would hope that 12 years ago, when we really began to aggressively attack this issue and put plans in place and constantly update and improve those plans, that the threat nationwide would be less than it was then. It's more, it's greater. I mean, it's not just a case of the 24/7 news cycle. I still hear people tell me, it's not really that it's more, it's just the 24/7 news cycle. No, the threat is serious, it's real, and when we got together, we didn't know what kind of opportunities and or threats might be identified because we have been meeting on a regular basis. But there were several areas that we need to look at, that we need to work on, and I think in part it's those that become vulnerabilities because of the threats. On the positive side, technology is much more robust today than it was 12 years ago. I won't go into the details, but I did share an experience from 2019 when I was at a conference in Las Vegas and was able to go behind the scenes at Caesars and see their nationwide security center. It was absolutely incredible. One of the things they did that I had never seen before was a social media software program that they ran on all their locations throughout the country relative to entertainment or bands that were coming in to try to identify potential threats. And those are the kinds of things that technology can address today that I don't think 12 years ago was as readily available. But the threat is definitely worse, and the mental health issue, and John, I think you can speak to this. We talked a little bit about mental health in our county jails, but mental health continues to be one of the #1 needs for counties from budgeting and in law enforcement. It's an enormous issue.
And we are dealing with individuals who commit crimes, are in crisis day in and day out, and first responders are the people that are interacting with them. And they pose a threat sometimes they do not, or they are a threat to themselves. And frankly, we spend inordinate amount of times trying to get them help. And also trying to get them to the right place. Jail, many times, is not the appropriate place for an individual in a mental health crisis. So we spend a lot of time and resources to get them to the right place. Yet, we all know those resources are not plentiful, and therefore it's a struggle day in and day out.
The other thing we talked about as a priority when we think about over the last 12 years, the message that has been consistent of all of our schools, all of our key stakeholders, our partners, is we're focused in on those 70,000 plus students we serve and the 5,000 staff members. It is and remains our top priority at all times. And that's why, while there may be a need for additional mental health services, it's not that there's a lack of willingness or commitment from the service providers. It's really just there's a lack of the pipeline and resources of individuals available. So that's an area that we're going to really be paying attention to. But over the past 12 years, that priority remains centered on those 70,000 plus students, 5,000 plus staff members.
Whenever a shooting like happened in Texas happens, I'm sure parents, their first thought is, wow, are my kids safe in school? I mean, that's naturally where your mind goes. So do you have a message to parents who see this, about, relative to the kind of general safety of their kids in school?
Well, one thing I want to share was the data point that came out. It was shared very early in the meeting that over the last 35 years, in a Gallup poll asking school-age parents what's their #1 concern, it continues to be the safety of their children in school. That's concerning. 35 years and it hasn't changed. It's still the #1 issue.
I think, thinking about that message to our families, and Mr. Del Rosario, please add to this, it's about the continued commitment for our training and preparation and communication. When we look at that, those are the priority areas. Our school leaders, our teachers, our support staff members remain committed and engaged with the whole idea of preparation, communication, and we know we've done a lot and we know there's more to do, and we are committed for the 22-23 school year with those efforts in priority areas.
And we talked about new technologies as well, what we can do to research those new technologies and bring them into our schools to make it safer as well.
And that is one thing in Berks County with all of our schools. We work collectively on consortium work and efforts. So when we're doing research, whether it's a communication device that we're utilizing across the county, whether that's something for security badges or ID badges, visitor sign-in processes, we do that from a consortium level as well, and we'll be doing that as we go into the 22-23 school year.
Any other questions?
Could I be saying spell your first and last name for us, please?
Yes, Russell Del Rosario, R-U-S-S-E-L-L. Last name is Del Rosario, D-E-L, capital R-O-S-A-R-I-O.
And can I have your title then?
Safety and Security Program Administrator. BCIU.
He wins for the
Yes.
longest title.
Yes.
I like DA,
Well,
shortest one.
We do want to say thank you for giving us the
Yes.
coverage. So Is there anything else you need from us?
Can I have you say spelling your first and last name?
Yep.
You
Same
want all of
thing.
us?
I
Yep,
know
yep.
we have, like, the
No, that's good.
questions,
No,
but
no, no,
just in
yep,
case.
yep. It's Dr. Jill Hackman, Jillhackman, and the Berks County Intermediate Unit Executive Director.
And I know who you two folks are, so.
Okay.